Hi,
Hello, how are you?
I'm Suzanne Farie, and I'm
Suzanne.
so excited to meet you and hear about zero gravity and what you guys have in store for us. I saw a ton of products over there, and I'm excited to hear what is available for the longevity space.
Great, thank you. It's been a pleasure to be here. We're really happy to have came and to present zero gravity. Zero gravity, the whole concept was how can we make devices with the deepest penetration possible in the red and infrared light therapy space. There's so much red light therapy out there and so many different devices, and there's the masks and the trending ones and this one, and there's a big salad in everybody's head. And I'm here to try to also break down what stands zero gravity apart and what our concept is in our devices that we make. And the biggest is how much we want to penetrate it into the body and into the skin and the muscle tissues.
It's so exciting because it's really hard for us to determine what's the difference and how do we tell what products to buy. And you can buy on Amazon, or do you get the expensive one? And does the money matter? Is the more expensive really valuable, or is it just a lot of marketing hype? So break it down for us so we can understand what we might use for your products.
So I would say whenever you're going shopping for a red light device or infrared light device, you always want to see what's the wavelength. So I brought here a wavelength chart. The wavelength chart is this one. So when you see those red light masks on Amazon, for example, you're generally seeing 600 to 650 nanometer, which goes to the dermis, right here, the dermis. Some of them have medical grade, 750 to 940, they go to the hypodermis. Our device goes past the hypodermis and can actually reach all the way to the bone. How so? It has a patented technology inside the glass head probe, which actually stop the scattering of the light and help it to go all the way to the bone, and because light naturally scatters. So by using the patented technology, we're getting it to go all the way to the bone. When you're getting it all the way to the bone, you can activate more cellular processes such as cartilage production, bone formation, bone strength, muscle regeneration. So they're able to do more with the device when you're getting it to go this deep, and this is really what stands us apart from other devices.
And is it the the wavelength that's doing that, or is it the fact that you're not scattering? Is it the
Both.
focus? Okay.
So the wavelength that's going to be that 750 to 940, we're not unique in that sense. There are other companies with 750 to 940, which is that stronger wavelength. But what makes us unique is that we have that magnifier in front of the diode inside the glass that stops the scattering. So that's what makes it go even deeper than the 750 to 940. It's good to find devices 750 to 940. Where you'll only find going this deep is because we have a patent, so it's the only company that's allowed to put this technology in front of the 750 to 940 diodes to help it go even deeper.
And I saw that you had an FDA approval sign. Is that true?
Yes, so it's a Class 2 medical device, and that's also a very important thing to look at. There's a lot of devices that are not in FDA cleared, they're not FDA approved, and it's okay. Some people like those devices that go to the dermis that are not FDA medical devices because I call them cute. It's like you have you want to dip your feet in the water. I'm not saying they don't help. They help. But if for medical grade, if you want something medically proven, you need at least this wavelength. And then if you want really to work the best, it's better to have it go even deeper. So this helps to clear a lot of that confusion that I was talking about. Now, when people see, they'll say, oh, 600 to 650. Oh, Robert was talking about 940. I hope I gave a little bit more of a clarification in the head.
And Robert, when you're using the device, how long do you use it for each cycle?
So if it's going to be on the face, it's going to be 2 to 3 minutes on each area of the skin, around twice a week. If it's going to be for pain, you're holding it on the area for 5 to 10 minutes. Again, because we're getting deep, we're able to treat pain as well. Neck pain, back pain, TMJ. I have TMJ specialists telling me that even the same day, patients are walking out with a lot more movement in the jaw and relief. So it's going to be generally between 5 to 10 minutes for the pain, 2 to 3 minutes for the skin.
So just 2 to 3. And are you moving it the whole time, or are you
moving it slowly? But I say sections. So we have 4 sections in our face. We have the forehead, right side, left side, and neck, chin area. So it's going to be 2 to 3, 2 to 3, 2 to 3, and 2 to 3. We're talking about a total of 15-minute session.
Okay. So it's a little bit of a
twice
commitment.
a week. Yes.
Twice a week. And what happens if you use it more often than that?
Nothing bad will happen to you. There's no UV lights inside. There's no damaging wavelength. It's just you won't have additional benefit from doing it every day than you would be doing it 2 or 3 times a week.
Okay, that's interesting.
Yeah.
So then how long do you think you use it before you notice a difference?
Actually, you'll start to see a difference in the right away. This is why we've been doing demonstrations on attendee goers who've been stopping, and we've been doing them the treatment, and they've been noticing right away a lift. Especially, we also have the radio frequency one that has added RF that even shows even more of a tightening effect. This one you only need to use once a week because it is a little bit stronger. But yes, you can start to see the effect right away. We generally say that the studies are showing between session 8 and 12 is when people are really noticing the most, like that really wow difference. But every session will be more. But between 8 and 12, it's like...
So you're talking 6 weeks before we see a big difference.
6 weeks is the full dosage, let's say. Like I'd say even like antibiotics, you start to feel better already after a few doses, right? But you still want to finish and take all of them to complete the course. So already people are going to see in a few treatments a lot better skin, but 6 weeks gives you the whole course, and then you can keep at once you get the result that you like, you can keep it once a week, once every 2 weeks, just to maintain the result that you have on your skin.
And do you stop using it at the end of 6 weeks?
If you don't stop, you just maintain less frequent treatments.
Okay. And
Yeah.
are you going to do this on clean skin, on washed skin? What are you
Clean
going to
skin.
do? Clean skin. So then would you ever do it over makeup or over that? What's not going to help?
No, you clean the makeup off ideally, clean dry skin for the first 2 to 3 minutes. You're putting nothing on the skin. Some people like to add a little serum, which it's a waterproof glass head probe. You can put it right on the head of the device and just go around one more pass for another 30 seconds around, and you really help penetrate that serum more in. But that's always towards the end. In the beginning, you want to just get the light traveling to the hypodermis, doing the effect of the device. Yeah.
Excellent. And then any other tips and tricks for regular use?
I would say I like to do it when my boyfriend is arguing with me, because then I don't have to listen to anything that he says. So I'll just take the device and just start using it, and then I can just pretend I'm not listening to anything he's saying, and I can just make myself prettier. No, I'm kidding. Just to use it at nighttime instead of the morning. Some people, get better results when they're using it at night. And the reason for that is when you're sleeping, you're actually allowing the cellular process to work better than going outside in the sun and interrupting the process. So I would say using it at night is a good tip. And also not forgetting to use it is a good
Consistency is key.
Yes. Yes, because they'll get good results, their life will get busy. Travel with it. Put it in your purse, put it in your travel bag, fly on it with the plane.
Do you have any tips about remembering when to use it?
So this is why we have the app in the App Store that will actually, once you download it, it'll send you reminders to use it to your phone.
Nice.
It'll create for you a personalized treatment schedule based on your skin type. It helps people remind them. Or another way to remind yourself is I'll just put it in my bathroom sink, like near the toothbrush and everything, and it'll help with that as well.
Okay. So I have a device that I got from someone at a conference years ago, and it has the the radio frequency on one end, and it has the red light on the other end, and it's red and green and blue. So why would you want red instead of green or blue?
Think about it like this. Infrared and red is on one side of our eyes can see from violet to red. Okay? So infrared and red is on one side of the light spectrum. Violet and ultraviolet is on the other side of the light spectrum. Ultraviolet is just what's damaging the skin. So you want to get its opposite wavelength. So the studies are showing the red and infrared is already doing everything. The yellow and the green and things like that, they're helpful, but in our view, a little bit unnecessary when you already have the red and infrared with the high wavelength, with the magnifiers, with everything. It's a little bit redundant to then go ahead and use other colors. The blue light is still necessary because that's killing B. acne bacteria if someone has acne. But when you have our red and infrared device, as far as anti-aging is concerned, don't really need to get into the other colors. Those are so strong that it completes all of those other wavelengths.
And when would you add the radio frequency?
The RF is something that you would do after you're using the red and infrared device. You can use the Genesis Prime after, just one pass around for like 2 to 3 minutes around each area again. And that'll just give you an extra tightening, extra snatched look, which a lot of people like. And also you can use it on the body as well. Cellulite, loose skin, arms, legs. So you just think of RF as loose skin that you want to tighten up.
Okay. Do you guys have any sort of show specials that's happening, or is there anything going on that's unique for us for longevity?
Yes, we do have show specials. Please come check out our booth, and we will be able to let you know what they are. It depends on which package you're taking, if it's coming with the eye, with the neck. We also have the big bed, the big panel beds, and the other ones. So please come see our booth and we'll get into all the different specials that we have.
What if we can't make it until after the conference for some reason? Is there a way we can get in touch with you afterward?
After the conference, I'll send you the contact information for them to have after.
Excellent.
Yes.
Thank you so much. It was nice to meet you, Robert.
Thank you.